Are we going to say a replay of the early 1990s in the Clinton administration in a move toward universal health care?
Well, certainly that's Speaker Pelosi's approach of nationalizing health care. I don't know, I think Senator Obama, if he would be the president, has been a little more cautious of how he says it, but in essence it's, I think, the same approach. So I think you will see it, and quite frankly, it's why I think Speaker Pelosi has not allowed us to move forward on proposals that we know will help, at least a certain number of Americans get more affordable health care. Association health plans, small business plans where, mom and pop printers across the country. Today, I use that as an example. A lot of printers that are just small operations, they go out and buy health insurance for a husband and wife. It's very expensive. But if they were able to go into a group policy with, say, 100,000 of others that are small mom and pop printers across the country, they would get a much less expensive plan from a provider. Federal law prohibits them from doing that. A corporation can do it and do it across the country and get that economy of scale and more affordable insurance, but those individuals can't bind themselves or go together and do it. It's not the end-all solution, but if we have 40+ million uninsured, it might help 1 million. Well, that's 1 million less uninsured.
2 years ago, there's another thing I suggested was health care had to be addressed. Every time you talk about creating a program, the opposition says, you're going to lose your personal physician. We don't want socialized medicine. There are all sorts of alternatives to that. And in fact, we already do have socialized medicine. We have Medicare, which is socialized. We have the military, which is the best medicine in the world. I mean, if you were in a traumatic situation, you would love to be near a military hospital. The difficulty with health care is that the costs are skyrocketing because we're not only paying for ourselves, we're paying for people who don't contribute to the pool. The Medicare program, which is dealing with the highest risk people in the country, everybody's there high risk, 65 or older, nevertheless manages to operate a program that's administratively cheaper than any other insurer we have right now. Why can't we get those insurers to do the same kind of thing? Increase the risk pool, perhaps, and lower those costs.